So we're going to take a look at immunity here. When we're looking at the lines of defense within immunity, we're basically looking at how can we prevent pathogens from coming in, and then what will be the immediate response to those pathogens. So when we look at lines of defense, we're looking at two principal types of immunity here, both of which happen to be innate, which means that they're immunity that we don't have to quote unquote learn about. These include the first line of defense, which are any of the external structures. These are the things that will prevent any pathogen from entering into the body. If we can keep the pathogens from entering the body, then we don't have to worry about having any of the secondary immune responses here. These include things like skin and mucous membranes, hair, cilia projections, oils, saliva, sudoriferous secretions, anything that makes either an inhospitable environment to pathogens or anything that creates a permanent barrier around the body, where if we can keep the barrier intact, we're able to make sure that nothing will enter through the integument into the body proper. When we look at this, we'll start with what we refer to as the non-specific defenses. So the non-specific defenses are the physical barriers, which include things like the skin and the mucous membranes. We'll see these within epidermis, within the mucous membranes, the hair around openings, as well as the cilia within the upper regions of the respiratory tract, all of which are going to either create a barrier or establish a means to get rid of any pathogen that has a chance of getting into the body. The secondary lines of defenses are all the secretions that are associated with the first line of defense. These include lacrimal secretions within the eye, saliva, urine, defecation, vomiting. For females, vaginal secretions, sebums, the oils that get secreted by the sebaceous glands, the perspiration and any of the acidic fluids within the body, which include gastric juices, as well as vaginal secretions, and secretions of lysosomes. What the secretions are doing is that they're creating an inhospitable region for the pathogens, or they're secreting enzymes such as lysosomes that will digest down the pathogens, or secreting liquids like acids, which will digest through the cell membranes, thereby allowing for osmotic fluid flow that leads to apoptosis of the pathogenic materials. So that's the first line of defense. The second line of defense is looking at what things have we acquired either through evolution or what things have we acquired over our lifespan. In this, we start having distinctions between what we refer to as active acquired versus innate acquired immunity. Innate acquired immunity is things that get passed to us due to previous generations' exposures to pathogens, whereas the acquired form of secondary lines of defense is where lymphocytes, quote unquote, learn how to go about, quote unquote, attacking any type of non-self antigen. In this, we have two types of acquired immunity that will take place, and we'll take a look at this in a little bit later on, in which an active form is where we get exposed to the pathogen, such as what's going on right now with the COVID-19, or a passive form of acquired, which occurs through vaccinations. Vaccinations come in two forms. One form is what we usually think of as vaccination, which is where we go to the physician and we get the injection with the vaccine. The other form of vaccination is what we get from our mom during neonatal care, breastfeeding. When we look at the secondary lines of defense, we start looking at changes of specificity. That is, what do we have to do in terms of activating the system? And then what do we have to do in terms of needing for that activated system to acquire a level of sophistication? That is, can they learn how to go about, quote unquote, attacking the pathogen? In this, we have distinct structures such as lymph vessels and nodes, the thymus and the spleen, all of the myeloid-derived cells that we looked at, such as the eosinophils, the basophils, and the neutrophils. And then we start looking at the lymphocytes. The first line of lymphocytic activity come from the natural killer cells. These are lymphocytes that are not B cells or T cells, which means that they understand what self and non-self look like in terms of antigen markers, but they don't go about through any type of immuno acquisition. They don't technically understand what they're doing. All they know is that this cell has an antigen that doesn't belong where it's supposed to be, and so it phagocytotically will ingest that cell. Then we start getting the macrophages coming into play. The phagocytes, such as macrophages and monocytes, which due to chemoattractant signals and activation, migrate into areas of infection or areas of injury where they will go about doing their activity. The last line of internal defense that we have the greatest level of specificity and show the greatest amount of immunocompetency. That is, they understand exactly what they're doing and understand how to go about responding to distinct immuno triggers. These are the T cells and the B cells. Then we get to the internal secretions. The internal secretions, just like with the structures, have an increasing level of specificity within them based off of what cells are secreting them and what they're going to go about doing. Interferons are produced by lymphocytes, macrophages, and fibroblasts in response to infection by viral agents, viruses. What they're going to do is they're going to hopefully prevent replication of the virus by interfering with the internal mechanisms of viral replication so as to inhibit total level of infection that takes place, to provide the lymphocytes and macrophages a chance to go about taking care of the immune response. Complement proteins, just like what their name stipulates, are going to complement immune reactions. These can be chemoattractant signals. These can be labeling markers such as immunoglobulins. What they're attempting to do is they're attempting to enhance the total level of immune reactions. I've given you a list of some of the interferons and some of the complement proteins within the packet, so make sure you take a look at those. Most of these are going to somehow cause or enhance phagocytotic activity. Some of them will contribute to inflammation and inflammatory response. Some of them are involved with inducing greater immune responses, such as histamine, such as serotonin, which cause more changes to take place, and we'll take a look at what they do when we look at inflammation and inflammatory responses. The iron binding proteins are going to bind to and clump onto iron molecules, free iron molecules that are necessary for bacterial growth and replication. By binding onto iron, what these iron binding proteins do is that they inhibit the rate at which bacteria can grow by limiting some of the cofactors necessary for bacterial replication. The last of the internal secretions that we look at are what we refer to as the antimicrobial proteins. The antimicrobial proteins are short peptide and small molecular weight proteins that have a broad spectrum antimicrobial activity. They can act as a chemoattractant signal to dendritic and mast cells. They can stimulate additional immune responses. What a lot of the antimicrobial proteins are going to do is that they're going to attempt to destroy, put quotes around that, the cell membrane and cell wall that we see within the bacterial components of infection. most of the antibiotics that we take are going to have some sort of mixture of a complement and an antimicrobial protein activity within the body, whereas many of the antivirals that we take are going to have something that's very similar to the interferon activity. This is why when you get a viral infection, you don't want to take an antimicrobial, because by taking an antibiotic, an antimicrobial, you're actually doing the opposite of what the body's trying to do, which is why when you have a viral infection, you actually want to do an interferonal medicine, whereas when you have a bacterial or a non-viral infection, you want to take something like a complement or an antimicrobial agent. Okay, just as a review of the histology, remember that in terms of lymphocytes, we have NK cells, T cells, and B cells. In terms of T cells, we have 3 levels: memory, helper, and killer. In terms of B cells, we have 3 levels. We have memory, plasmal, and clonal. Each one is going to dictate what that T cell and what that B cell is doing. We have macrophages, we have eosinophils, we have basophils, we have megakaryocytes, thrombocytes, and we have neutrophils. Each one of these types of cells will be differentiated based off of what we refer to as the CD factoring. And just as with some of the secretions, I've given you a table of the various CD factors, and we'll take a look at 2 specific CD factors in a couple seconds here.